Welcome to the GE Healthcare Library of Videos, developed exclusively for users of our maternal infant care products, all designed to help you take full advantage of your GE equipment on behalf of your youngest and most fragile patients. In this session, we'll focus on treating a problem that is fairly common in neonates, hyperbilirubinemia, and its potentially devastating complications. Hyperbilirubinemia is the result of a breakdown of red blood cell byproducts that become evident with yellowing of the skin, eyes, and rising blood levels over time. It's usually self-limiting in newborns and often resolves without medical intervention. However, hyperbilirubinemia can be toxic to an infant's central nervous system and can lead to a brain-damaging condition known as kernicterus, a condition with long-term neurological effects that can include severe cerebral palsy. That's why in the U.S., the medical community and accreditation agencies like JCAHO have turned their attention to the problem, embracing advances in phototherapeutic technology to manage hyperbilirubinemia and prevent kernicterus. No one knows the precise concentration or duration of hyperbilirubinemia that leads to neurotoxicity. But best practices can lead to early identification of at-risk infants and intervention before bilirubin concentrations become too high. That's why phototherapy is such a critical tool in neonatal care, and why it's so important to know how to achieve the best possible results with your GE phototherapy equipment. Let's start with the guidelines offered by the American Academy of Pediatrics, whose goal is reducing the frequency of severe neonatal hyperbilirubinemia and bilirubin encephalopathy, while minimizing the risk of unintended harm. It begins with assessments of each infant during the first days of life through discharge. This can be done visually, but preferably by measuring total serum bilirubin, or perhaps by obtaining transcutaneous bilirubin levels, and then interpreting the levels according to the baby's age in hours. It continues with close follow-up. That means providing parents with written and verbal information about newborn jaundice, promoting and supporting successful breastfeeding as early as possible, and providing appropriate follow-up after discharge, depending on your risk assessment. When indicated, we implement the best possible intervention. Ideally, the intensive phototherapy we'll describe in just a few moments, while ensuring appropriate hydration of the infant. With these guidelines as a framework, let's consider how this technology works. When phototherapy light of the proper intensity penetrates the surface of the skin, it induces chemical changes in the bilirubin molecule, transforming it into water-soluble form. In this form, the molecules can enter the liver for conjugation and excretion, and eventually elimination from the body. There are multiple factors which determine the effectiveness of phototherapy treatment. These factors include the wavelength of the light and its irradiance or intensity, the skin surface area exposed, the duration of the exposure, and the distance between the light source and the patient. We can maximize phototherapy's effectiveness by delivering light at the optimum wavelength for absorption by bilirubin molecules, 450 to 460 nanometers. It all adds up to total dose, which is what determines the efficacy of phototherapy. And that efficacy can be magnified significantly by the intensive phototherapy mentioned earlier, which delivers high levels of irradiance to as much of the infant surface area as possible. As we recommend in our user manuals, irradiance should be measured throughout therapy to ensure that the desired levels are being reached and maintained for the duration of therapy. Perhaps surprisingly, phototherapy systems can vary as widely as the types of lamps they use, and there are no standardized methods for delivering these treatments. There are 4 basic types of device today: fluorescent, fiber optic, blue LED and incandescent, or halogen. Each one delivers a different sort of irradiance, and understanding the differences can help you make the best possible use of your equipment. Each offers distinct advantages for particular clinical situations, which is why at GE we offer several alternatives. We use fiber optic technology in our BiliBlanket Plus high-output phototherapy system. LED technology for the BiliSoft LED Phototherapy system, and incandescent halogen technology for our Giraffe Spot PT light. Our BiliBlanket Plus high output uses fiber optic technology. That makes it exceptionally convenient, lending itself readily to blanket application. And unlike some solutions, BiliBlanket Plus has no impact on the infant's thermal regulation, although monitoring the infant during therapy is recommended. What's more, BiliBlanket's fiber optics support developmental care, allowing an infant to undergo phototherapy while snuggling with mom or dad. In fact, this technology is ideal for use with a comfortable pad, which is especially important for low birth weight infants in need of developmental positioning aids. Lastly, and really most important, the fiber optic light of BiliBlanket Plus high output falls into the recommended 430 to 490 nanometer bandwidth recommended by AAP, so it's closely matched to bilirubin's optimized absorption wavelength of 450 to 460. Our BiliSoft LED phototherapy system uses LED technology, which offers its own considerable advantages. Again, its output is intensive, and in the same 430 to 490 nanometer bandwidth that AAP recommends. And our LED light engine lasts 10,000 hours or more. BiliSoft is also a very quiet system. Soft, encompassing, family-centered, and developmentally supportive. And it's fully X-ray compatible, so the infant can be imaged without being disturbed. As a result, BiliSoft can be a great solution for locations from NICU to nursery to home for both preterm and term infants. Finally, for our Giraffe Spot PT Light phototherapy system, we choose to use low-heat metal halide technology to deliver the phototherapy light through a fiber optic light pipe. This approach allows you to deliver effective phototherapy in a minimal amount of space. Its gooseneck configuration means you can position the light pipe precisely where it's needed, and its bulb lasts up to 6 times as long as other phototherapy bulbs. Equally important, Giraffe Spot PT Light is a developmentally sensitive system that minimizes an infant's thermal stress, and it's extremely safe, filtering out both ultraviolet and infrared light. There are a number of other factors to consider in order to optimize patient care, because, frankly, phototherapy is not an entirely benign intervention. Its side effects can range from bleaching of the skin to rashes, from temperature instability to dehydration and watery stools. As a result, it's very important that you monitor the fluid and electrolyte balance of any infant undergoing phototherapy, as well as his or her skin integrity and temperature. We recommend a systematic approach for managing hyperbilirubinemia. It starts with careful pre-discharge bilirubin management, including not just visual evaluation, but also transcutaneous and/or serum bilirubin evaluation, universal, hour-specific total serum bilirubin assessment, evaluation for hemolysis and risk factors, and thorough education of parents. Finally, this systematic approach mandates equally cautious post-discharge bilirubin management, including follow-up by a physician or pediatric nurse when the baby reaches 96 hours of age, or sooner if the risk is high, as well as expert nutritional assessment and lactation support. By following the best practices of current healthcare protocols and policies, strategies such as these will help you take full advantage of your phototherapy equipment. It is our hope that, as a result, you will be able to help all the infants in your care avoid the potentially devastating effects of hyperbilirubinemia. If you have any questions about phototherapy, don't hesitate to contact your GE representative. And please visit us at www.gehealthcare.com to learn about our growing library of educational offerings.